they've decided is best for me. It hurts because really I risk it every day that I wake up. And I do it because I still feel good enough, and I still have enough joy, and I still laugh and smile with my family and friends enough that it doesn't seem like the right time right now, but it will come because I feel myself getting sicker. It's happening each week. I still get out and do what I can. I walk with my husband, I walk with my family and my dogs. And things like that bring me the greatest feelings of health that I have these days. But really it's been just since January 1st, that's my diagnosis. Otherwise things keep just getting worse. But I guess that's what happens when you're terminally ill, is you get sicker and sicker.
Okay. Brittany Maynard was 29 years old when she took her own life, as allowed through Oregon's Death with Dignity laws after suffering terminal brain cancer. She would not have been able to do this in most other places throughout the country because they do not offer the solution to life-altering medical conditions that Oregon does.
We, as a group, for our research, decided to investigate whether it would be good for the U.S. to make national laws allowing death with dignity.
The topic of euthanasia has been present in the United States since the first bill was introduced in Ohio in 1906. Euthanasia, unlike the death with dignity movement, requires the direct action of a physician in killing the patient, while physician-assisted suicide permits the physician to give the patient the means to end their own life, and then the patient can choose their time to die in the comfort of their own home surrounded by those who love them, like in the case of Brittany Maynard. Laws allowing this were first passed in Oregon, where physicians were permitted to prescribe medicines for their patients to use to have an assisted death. Similar laws exist in states like Washington, Vermont, and most recently in California. These states allow the solution to people suffering terminal illness, which is defined as a condition that there is no reasonable expectation of the victim to recover from, and who are expected to die within the next 6 months of their request. In these states, they are required to make 2 oral requests to their doctor, 15 days apart from each other, and a written request must accompany the second request. Physicians in Montana are also allowed to administer this medication with a written request for the patient, and there are currently efforts in order to establish formal laws for the process. As seen in the 2015 report from Oregon, in the large majority of people who choose this option are those suffering from cancer, being 72% of those who receive the service.
After Brittany Maynard's story was heard by millions of people, support for assisted suicide increased in all groups that were surveyed. Terminal illness is a terrible problem for anyone to deal with. Not only does it take its toll physically, but it can seriously affect the psychological health of those involved. Patients affected by terminal illness never know how much time they have left. Giving those affected by terminal illness the option of assisted suicide allows a patient to live their life on their own terms. Both doctors and religious groups have spoken out about death with dignity laws. Most religious groups, including most Christian groups, Judaism, and Islam, are against euthanasia because they do not believe people should end any life unnecessarily. However, there are a few groups that support death with dignity laws, including the United Church of Christ, the Methodist Church on the West Coast, and Quakers. Conversely, presently the support for death with dignity laws by doctors is at 54% and is on the rise. One study suggested that a gradual increase in doctor support could help death with dignity laws be passed despite resistance by some religious groups.
Death with dignity saves a lot of money for the people with them. The majority of people end their lives 4 weeks before they would die naturally. In the hospital, this could save a family up to $56,000. This money could be spent on a funeral or spent on other necessities. People cannot afford to have this.
Many groups benefit economically from terminally ill patients opting to die with dignity, but insurance companies do not. It can be very expensive for people to stay in a hospital, especially over a long period of time. Luckily, insurance companies cover nearly all of the costs for the patients, but as a result, will raise their insurance rates. So, when terminally ill patients opt for death with dignity, they shorten their time in the hospital and lower their spending on medications, and therefore do not allow insurance companies to gain as much money. However, insurance companies are able to collect enough money from other sources, such as non-terminally ill patients, that they will not be greatly affected. Just think about it. Which do you think is more important? The amount of money lost by insurance companies, or the cost of terminally ill patients' dignity?
The majority of people who are on death's row, are over 65 years old. This means that they qualify for Medicare, a nationally funded program to give medical assistance to elderly. The way that this works means that elderly people are insured, but they're insured with the rest of the population's money. The majority of the population is paying for people to live for people to stay on life support when they're going to die anyways. The cost of a pill costs $100, and it would be fully insured by Medicare. With the billions that we're saving doing this, we could spend it allocating research to other problems or insuring other people more. Religious groups are also are the main people who are against death with dignity. People believe that the human life is sacrosanct, and there's nothing that you should do to end it. A job of the person is to care and to support them through it. They cannot remove the weight of their own cross. But this goes against everything that our nation stands for. Our nation was built on the belief that everybody believes what they want to. Just because somebody believes that it shouldn't exist doesn't mean that it can't. We should have the option to do it, even if people are against it.
Because of this information, we support a plan that involves the creation of a federal law legalizing the choice of a physician-assisted suicide for people experiencing a life-altering medical condition in America. We believe that, similarly to other heavily debated issues such as gay marriage and abortion, an individual's personal beliefs and opinions should not have an impact on the lives of those involved in the issue, and that it should be left as an option for those people who feel it fits their specific circumstance. This decision could be a very difficult one to make, but the decision should be there for people, like Brittany Maynard, who feel like it is a good option for their specific condition. Similarly to Oregon and other states where it is legal, we should require that the country create an annual report with the information about the medical practice in America, including the number of physician-assisted suicides that occurred, where they occurred, and what conditions they had that led them to requesting the condition. So that way it can be monitored by physicians and statisticians in order to maintain that it is not being abused and that only people who fit these requirements are allowed to receive this medication.
Okay, hold on 1 second. Okay. How did your research question evolve as you moved through this?
When we first developed our question, we thought that we were going to have a more anti-stance towards the issue, but once we looked into the issue, and especially once we found the case with Brittany Maynard, we saw how it really can be the difference between how a condition can affect the person's not only how they live their life, but how they psychologically think about themselves and how it's affected them.
Interesting. How valid and reliable are the sources you've used? How do you know? And which sources did not work?
A lot of the sources that we did were made from scientific journals that traced the amount of money that was being spent on these people. These journals have been nationally in this subject are considered the pinnacles of the debate. We also looked a lot on websites concerning national hospital not the cost of hospitalization and the way that insurance companies work, and we checked and made sure that these were like nonpartisan websites that have done work before.
Great, thank you. One more?
If you had more time, what additional research would you have conducted about this issue?
We didn't do too much about like euthanasia, how it has been in other countries, such as like the Netherlands. So we could have looked more into that and shown how we could have maybe made a better plan to bring it into the United States.
Great, thank you. Great.